Welcome to Raregivers 2023, a global festival of wellness. My name is Crystal Barrett O'Loughlin, and I am the founder and CEO of Angel Aid. I'm so excited for today. Today, we're going to have an interview with who has become a dear friend, Jay Singh. And Jay is working with the USAID department. He is a powerhouse in government and public and private affairs. And we're going to have a deep conversation about the importance of mental health and wellness. In just a few minutes, I'll be introducing Jay. So in the meantime, I'd like to share with you just for a moment what Angel Aid is all about. We have a very aggressive but needed agenda on the global arena, and it has to do with mental health and wellness. Angel Aid is a global nonprofit network. We provide personal connection and heartfelt emotional support to patients, to parents and caregivers, and to professionals in the rare, chronic, and complex disease communities around the world. These are families and individuals that are feeling isolated because of their medicalized life. They're feeling overwhelmed by the healthcare system, by symptom management, by the diagnostic process, by treatment management, and really just by all of the complexities that happen when life gets medical. And our agenda is to bring daily compassion and relief into these families. Our goal is to support 3.5 million Raregivers by 2026. And I know that we can achieve this goal based on the partnerships and the advisors, the volunteers, and the supporters that we have around the world. And there's a long history coming to this point. I wanted to share for a moment with you my personal passion, why I've gotten involved in this world. Through my parents, so often family experiences are what ignite our passions. And Richard and Phyllis Barrett married in 1963. They had been high school sweethearts. They wanted a very big family, and we had 5 Barrett kids within 8 years in our family. My oldest brother, Richard, is here in the picture on the right, and I'm the youngest. And what you can probably see in David, Jared, and Randy is slightly coarse facial features, slightly stunted growth. In fact, what my parents realized is my claimed the life of my 3 older brothers at 12 years old, 18, and 19 years old. Our whole family was caught up in the support of my brothers. And it was the stress of their caregiving that actually broke the family apart. My parents divorced in 1975. If you stick to the end of this broadcast, I will promise you a very happy ending to this story. But in the meantime, it's this life experience that is driving the driving force behind the formation of Angel Aid. And what I will say is that our story, while it's unique in its specifics, it's very common in the world, that all of us have some form of suffering. And it's in this suffering that we're able to find this common empathetic connection, this common experience called humanity. And this is a global challenge. In the rare disease space, specifically, rare is not rare. There are more people with rare diseases than AIDS and cancer combined. In fact, over 10,000 diseases are classified as rare, and you've probably heard of many of them: cystic fibrosis, multiple sclerosis, ALS disease, and then more obscure diseases like Tay-Sachs and MPS and Pompe and Fabry. In aggregate, it's 350 million people around the world are grappling with the realities of rare diseases. And the number that sticks in my heart every day and the work that we do is that there are 0 cures currently for any rare disease. I call this empathy math. if you have 350 million patients and caregivers around the world multiplied by zero cures, you in fact have a global mental health crisis on your hands. And in fact, we align with the United Nations Sustainable Development Goals, the assumption that it's a fundamental human right to have good health and well-being, not just the assumption of physical health, but also emotional well-being. And that's what we seek to strive here at Angel Aid every day, is that blending of mental health and physical health. In fact, we've delivered 21,000 hours of wellness training into our community. We have over 22 psychologists and practitioners that are leading the peer-to-peer support. And we've grown from last year, we had 500 families to over 15,000 families in our network, on our way to our quest to support 3.5 million Raregivers by 2026. We can't do any of this work without very good tools, and it's a coalition of experts that have helped us develop our open source tools. The Raregivers Emotional Journey Map is actually a downloadable tool. It's used by patients, parents, and professionals in the rare disease community to help individuals feel witnessed on their journey, to have a place to orient their feelings and to say, this is where I am, but sometimes I feel, over here, even though I'm in a diagnostic journey, I'm worried about an end of life experience. And these are the feelings that are brought up in that experience. So thank you very much to all of the volunteer and invested experts that have helped us come up with these tools, for the networks of support that we're activating in service to our rare community. And really, it's advisors that help us form and shape our strategy. It's advisors like Singh, who I met in Washington, D.C., just over about 6 months ago. It's been an amazing journey getting to know Jay, and I can't wait to just take a few minutes and have this live interview with Jay. So I'm going to stop sharing here and just welcome you, Jay. You're on mute, but please come off mute and say a few words. Welcome.
Oh, thank you so much. I really appreciate it. I think this for me is we all have our journeys, but I just think what you have started, I fell in love with, because I've never seen something like this before. And it just, for me, just when we first met, it just triggered something in me, that I've been through so many war zones in my career as a foreign service officer, that this was such a what you're doing is, it became a calling for me in a way.
That is amazing, especially with this long history that you have. Maybe you could share your background with our audience.
Great. So I come from a long line of military. My great uncle, my father, my brother, we all served. And I served as a foreign service officer, and I largely, prior to my career, I served a lot of war zones, from Afghanistan, working in Somalia, to Mali, to Congo, and other places in between. So I've seen plenty of death and destruction and the devastation it causes, but I've also seen struggles of people who are now dealing with the victims who have gone through the war. My own friends who've been to PTSD, I had mild PTSD. We all go through those types of mental health, but of course, what you're providing here is beyond just the individual. It's the collateral damage, I call it, of mental health. The person who's suffering from the rare disease or suffering, but the people around them also are part of that process and journey. And that is, no one looks at those. This is such an interesting a focus and journey that you have embarked me on that I just fall in love with it. So.
It is amazing. And it's interesting because when we talk about the world of rare disease, it's a misnomer. It's not rare, is it? It's so frequent.
No.
And you've probably, in your career and in your personal life, you've witnessed many families that have lived with emotional impact of their experiences, but also physical impact of their experiences. What kinds of support services have you seen either in the military or in the hospital networks or any other networks that families have been turning to in your world for support?
So in the military community, they have actually the VA system, and they do actually have good access to resources. It's just getting the people to access those resources oftentimes. But the other thing is, it's also very personal. These things when you go through these things, it's very personal. For the person suffering from whatever ailment they have, disease or disfigurement or loss of limb from wherever they come from, that's a very personal struggle. But the thing is, and oftentimes what gets missed is the people around them. Like, I'll give my example. My father, sir, and he died of bone cancer and dementia, and watching this two-time Gallantry Award winner go through this was heartbreaking for myself, my mother, and my brother, who was a one-star. We all had a hard time dealing with this giant of a man who crumpled up and could not even ask for help. And then I just seen my wife when I was in Afghanistan towards the end of my tour. Luckily, my wife was diagnosed with breast cancer. So I've seen, and again, I had the foreign service community around me to support and get me back out to be with my wife where she went through her treatment. But again, the focus is on the patient, right? Not on the caregiver. And the caregiver is supposed to be seen as this giant of a person who's always there, is criticized for not being there. So I think there's a lot of pressure on the caregiver to have something focused on the caregiver itself is for me is a really important aspect of who we are as human beings. And I think what Angel is doing is something very unique. And I think we have to recognize the caregivers. We look at the nurses, the doctors, all those who actually provide the medical, clinical care, but it's the emotional care and the care at home that's hardest in my mind.
Thank you for sharing those two deeply personal examples, Jay. That's one of the things that I really appreciate about you is as a leader and an executive, and you're just so willing to be open. And I think it's that openness that breaks down the stigma in talking about these things, right? And we know that when actually hiring active military before they are discharged from active service to identify a primary source of support. And that both that primary source of support and the active military serviceman or woman be exposed to mental health and well-being conversations and education. And I think the thing there is to break down the stigma, right? We know you're going to be impacted. You have to. You're an elite life experience, right? So let's talk about it from the beginning. Can you share any thoughts or experiences there?
So I can talk both from the military side and the diplomatic side, because now a lot of my colleagues in the Foreign Service have now served side by side. I worked with the 82nd Airborne when I was in Afghanistan, so I've seen both sides of the equation where we're unarmed and they're armed, and you get into a battle, we're hunkered down while they're fighting for us. So there's that, but I've also seen. So I think there's a lot of focus on making sure we stay connected to our families and all that stuff. But I think what needs to happen, I think Admiral McCraven, I really appreciated what he did with the Special Forces community. He allocated, I think it was close to $1 billion for families to make sure that when the soldiers come back, the families had the resources to support them when they came back. We have not seen that in the civilian world, and I think a lot of us who are civilians who are in government service would also benefit from something like that. I'm not throwing anybody under the bus per se, It's just not our culture. This all the stuff after 9/11 has become. We have a different world right now.
It is. It is. It's the meta crisis of the world was one of the things earlier in the series of broadcasts that Dr. Alyssa Eppel from UCSF has been talking about, how these screens are bringing crisis, not only for the individual that's going through it, but bringing it into our everyday existence in a way like never before. And
Mm,
that we need to protect ourselves in some way from an overwhelm, an overflow of information, and tap into some of the ancient arts of mindfulness and meditation and
mm.
yoga and eating well and sleep and all the things we know we should do for ourselves that we always say, oh, I'll do that later. But I'm curious to know what do you turn to specifically for your self-care and well-being? How do you get the stress out of your psyche and your body?
So if you don't mind, I might take a few minutes to answer that question. I'll give you two examples. One, when I was working on child soldiers in Africa, so we had a camp where we had these child soldiers came back, and we were trying to rehabilitate them. This is about almost 18 years ago, and I was in this camp where we had these captured child soldiers, like 12 years old, 13 years old kids, as old as my kids were. And I looked into the eyes, and they asked me, "Hey, why don't you ask them a question or two about?" I said, "No, I'm not going to ask any of these kids a question because I'm not a trained psychologist." And asking a question and the kid telling you their answer, um, that's your burden as well, because now you've experienced and they've shared their pain with you. And I was not trained to do that. I mean, I went back to overcome that. I went back to my family and my kids and gave them a hug because I felt really blessed because I had my kids with me. But what these kids had done, it was incredible. And then another place in Congo, we had these warring factions were using rape as a tool of war. So spending time with the rape victims was also eye-opening because then they share their stories with you and they become part of your psyche. And all of a sudden, you as not a caregiver per se, but as a person who carrying that, sharing that burden of that knowledge and experience, it becomes a part of you. And so I have a lot of people around me who have gone through that, to rape or through disfigurement because of war. You carry that with you. So it's very hard. So for me, what I've been able to do is, I mean, I do meditate. I do believe that, faith is an important part of who I am, but not the faith in terms of a doctrine. I see faith as part of my meditative ability to look at the universe at writ large, right? And I think as we connect ourselves, we have to take time for ourselves spiritually to just decompress. But I think having friends around you, I think this is which I like about caregivers is that, caregivers need friends who understand what they're going through and can share that journey with them. And that's so important. I've been able to do that. A lot of my friends, and we shared our pain, and then that has lightened our load. Because I know someone who's been through what I've been through because they've shared it with me, and vice versa. Even though physically I had not been through what they went through, but at least emotionally I've known their pain, and I've seen their eyes and the tears, and I've incorporated that. So then that has helped lighten their load. So I always make it a point to make sure people are able to lighten their load.
Mm.
Even in my mission right now, and the head of mission here, I've mandated, 3 hours a week. Please go work out. Just get out of the office and take 1 hour plus another half hour every day just to do something different for yourself and not think about work. I just think it's so important that we have to free ourselves mentally and not get so bound up in our work. And that's how I see, making sure I can make my colleagues smile. And if I can do that, then that smile becomes my smile, and that's important.
Yeah. I feel that, Jay. I feel that just personally, having gotten to know you over the past many months. It's an interesting dynamic in our groups, in our support groups. We actually ask that the caregivers leave the disease at the door just set all of the symptom management, disease management, doctor's appointments, insurance claims, all, all of the left brain kind of triage list of things that need to happen, set those aside and step into just that heart to heart active listening and conversation with each other. That witnessing is what we find brings relief, which so often translates into friendships within our community. So I was so glad that you brought that.
But the other thing that I do is I practice being alone.
Mm,
Um, so you want to, because I think, we also need to recharge. I think just being alone and being comfortable by being alone is also cathartic in many ways. I mean, you need to have friends and, hang out and do fun stuff with them. But I think you taking time for yourself and the self-care that you need to have for yourself is really important. And no one can do that better than yourself.
yeah. Yeah, thank you for that. And there's a story about Bill Gates. When he was a young man, the whole family was packed up in the car. They were going somewhere, and he was up in his room, and everybody was waiting. And his mother went up, and she said, "Bill, what are you doing?" And he said, "I'm thinking, mother." Right? I just am thinking. I just need a minute to think. So sometimes we just need that time alone to think. Changing directions and using Microsoft as an example, there's a vulnerability in leadership. Satya Nadella is the current CEO of Microsoft and has been very vocal and public about his journey, he and his wife and family's journey with their son who passed away last year and suffered from some quite significant impacts from a health standpoint. And what are your thoughts on the leadership in this country and other countries around the world, private sector, public sector, about how we can just encourage society to be more vulnerable and to talk about emotional well-being? Do you have any sort of big picture final thoughts on how we can
Oh
change
God, where
the
can I
world together?
start?
No pressure.
I mean, I just think, given what's going on in the Middle East and Ukraine, having served in these places, it's hard to think about these things. I honestly feel, this is my personal opinion, healthcare needs to be a right. That we all deserve to have healthcare no matter what. And I know it's a very European model, but I just think on ourselves, we need to think through. I think what Satya has shared with his story is a good example. I mean, he had the resources, but the fact that he shared it with us, it's a human story, right? I think all of us need to recognize that as humans, um, there's a level of community that we need to develop amongst ourselves of what we're going through. No matter what level you are, you can be at the lowest level or at the highest level, like the head of the CEO of Microsoft. I mean, they're powerful people, but they still suffer the same way we do. They all bleed like we do. They all suffer the same way we do. So there's a sense of community that we need to share and develop. And I think what really we need to look at is, all the political discourse, get beyond that. Think about ourselves as human beings, as a community, that our higher purpose is to be humans and to care for each other in many ways. So I think, if you want to change the way we look at life, and it's to think through and be, one of the things we're taught is, when you're doing negotiations, is put yourself in the other person's shoes. Right? You have to put that. There's one aspect, you have to, you toe the line of the U.S. government and our foreign policy, but you do much better if you put yourself in the other person's shoes, where they're coming from, and then you build that sense of camaraderie and companionship. And I think we need to do more of that. And I think, in a roundabout way, I think what Satya has done, what you started with the Angel Aid, is delivering that sense of community of care that we dramatically and desperately need.
Jay, there is such wisdom and such a heartfelt uh, set of thoughts. I'm so grateful to you. I'm grateful to you for joining our advisory board. I just really enjoyed getting to know you as a person, and I hope that we can, continue to lean in on the friendship aspects, on the laughter aspects, and kind of challenging those around us to think about the whole family, about caregivers, and any final thoughts that you'd like to share as we wind up our interview.
I just think, I think family is what you make of it, right? It's not just your people you're married to or your blood relations. It's, you're taught in military or in foreign service that your family is the people around you. And as we grow our community as caregivers, and caregivers need family around them too to, help support them. I just want to say thank you for including me in this journey.
You heard it here. Jay Singh, thank you so much. I hope
Thank
at
you.
some point there'll be an opportunity to rendezvous in Jamaica. I know you're the mission
I hope
director.
you do.
Congratulations on that assignment, and we will see you again, hopefully
Thank you
someday.
so much. Appreciate
Thank
it.
you.
Thank
Thank
you.
you. Okay, so I'm just going to take a few moments and remind our viewers today of really what we're all about. And this Raregivers movement is a collection of hearts. It's a collection of individuals, of board members, of volunteers, of donors, of patients and caregivers and professionals who are all working in concert together to bring emotional relief. And the Raregivers name is reflective of that. So now that you've been exposed to our world, you are in fact a Raregiver. And we invite you to lean in and enjoy the community that we have been bringing together, and to support the community financially. A donation to Angel Aid is a donation to the Raregivers movement and the programs that we provide to the community that we're building. If you are a Microsoft employee and it is the month of October, we invite you to donate via Benevity. Microsoft donations to Angel Aid are matched during the month of October, and you can find Benevity through the QR code below or aka.ms/Angel Aid. If you're outside the Microsoft network and you'd like to support our services and our community building with a donation, you can do so at angelaidcares.org/give. We do have a donation guide. We want you to know what your dollars are going towards. They're going towards live crisis health calls, weekly support groups, activating friends to become friends and listen actively with each other, peer-to-peer support. We provide wellness kits into the home to bring relief for often chronically stressful moments like needle pokes. We provide wellness retreat experiences and ongoing support after the experience. And for our Archangel level, those are the change makers in our community that are funding these services at the $5,000 and more level. Thank you so much to our sponsors and our supporters, both from outside the pharmaceutical industry, inside the pharmaceutical industry, and also the patient advocacy organizations that have entrusted us to continue to develop and evolve these mental health support services. In particular, I'd like to call out our newest member, the National Organization of Rare Diseases, NORD. And you may have noticed a little logo in the bottom right of that logo slide. It's called the Purble. Purble is a calming companion. It was Time Magazine's best invention of 2021. This little guy or gal, depending on what gender you'd like to assign, if you hold a Purble up to your heart and do a gentle petting, he or she will start purring, and you can hear and feel the calming effect. It's one of the most simple and elegant tools for calming children and adults. And we would like to give you an opportunity to win a purple. So for every donation that's made during our Give Month, you will be entered in our drawing to win a purple. So please do make a donation, make a tangible donation to Angel Aid and the support that we provide. In fact, we'd like to thank the many donors and volunteers that have helped make this experience possible and helped make our community possible. Just in the last year, because of your support, we were able to host our very first Spanish-speaking Rare Mothers program outside of Mexico City. We were able to host our first Australia retreat for caregivers in the epilepsy community. And we hosted our first men's retreat here in Barrett Family Ranch in Orange County, California. So thank you. It was your support last year that brought that to us. And in fact, this is a love story. I promised you at the beginning of this broadcast a happy ending to this lifelong experience in the Barrett family. That couple, Richard and Phyllis, that married in 1963, they actually had a long history of forgiveness and discussion about the tragic circumstances that they experienced. And though they did remarry, each of them 2 more times, they found themselves about 15 years ago widowed. And right around that time, the birth of their granddaughter, our daughter, was born. And Richard and Phyllis reunited. They've been back together for quite some time now. And in fact, this year we married my parents yet again, 60 years after the first time here in 2023. So that is a love story for the ages. I hope that you find elements of grace and understanding in family members and those in your community. It's made a huge difference in our Barrett family. We welcome your support, and we welcome anything that you can do to spread the word about Angel Aid and the Raregivers movement. And in fact, if there's anybody in your community, either personal or professional or societal, that you think would benefit from our services, please refer them to angelaidcares.org. Have us follow on social, Facebook, Instagram, Twitter, or LinkedIn at Angel Aid Cares. And if you'd like to download a copy of the emotional journey map and the discussion guide that goes with it, you can visit raregivers.global. So thank you again. Really appreciate your time today, your attention,